governor's calling up. Basketball player.
It's one of that recall ladies trying to hitch a ride with anybody. How are we doing? Everybody ready? Good afternoon. First, happy birthday to the stranger. It's their 30th anniversary of their first publication. Good news from the Kraken. Their training session, I believe, started today, and they have a 100% vaccination rate. Congratulations to the Kraken. Today, I'm extending the statewide eviction bridge for 30 days until the end of October to make sure that local governments have an opportunity to issue the rental relief that is now available to citizens. This brief extension will help ensure that no one is evicted while large amounts of rental assistance funding is still available but unused. This bridge was currently set to expire, as you know, on September 30th, But we're hearing that counties need a little more time to be able to effectuate the rental relief that is available today to citizens. We have good reason to believe that counties will be able to move more quickly now, in part because the U.S. Treasury has changed some of their rules that makes it's much easier to distribute the money to citizens. We're moving toward the permanent solution that came about through the work with the legislature in the last session. I deliberately moved this process through the legislature to provide a long-term solution, and I'm extending the bridge to be able to make sure that that solution gets in place. There has been good progress made by counties to establish eviction resolution programs. 27 of 39 counties already have such a program in place. As you know, we also have strong tenancy preservation policies now in place because of House Bill 1236 and Senate Bill 5160. I want to thank Senator Cooter and Representative Macri as the prime sponsor of those two bills. We've done a lot to have a more sustainable situation in Washington because of this legislation. Landlords under this must offer tenants a reasonable repayment plan for any back rent. Landlords must include information regarding a tenant's right to legal counsel, and we are one of the first states to provide the right to legal counsel to tenants in this regard, while they're issuing a 2-week notice to pay or vacate. And they must provide information about the dispute resolution program under local eviction resolution programs. But we do need to see more progress on these relief programs, both for tenants and landlords. Money intended to keep renters housed and keep landlords in business is available, and it needs to get distributed as soon as possible, obviously. And we're helping local leaders where we can do that. We encourage our local governments to redouble their efforts, and we'll continue to rely on the good faith partnership we've enjoyed with our state landlords as we navigate these extraordinary times. We think this extension provides ample time for these funds to get out to citizens. Our economy is improving, unemployment is down, and we're at the point where this makes sense. And I'd be remiss not to mention that, as I've said, we are the first state in the country to have a right to counsel in eviction proceedings. This should be standard across the country. I hope our leadership will be followed in other places in the future. So our extension will expire on October 30th at 11:59. Just some advice, practical advice for people. The Washington State Office of Attorney General has information in multiple languages on available resources to help you pay your rent, including state and local rental assistance programs. That's available at this website on your screen, www.atg.wa.gov/landlord-tenant. State law provides you the right to representation, to legal representation. And the court may be able to appoint you a lawyer to represent you without cost if you are a qualifying low-income renter. If you believe you're a qualifying low-income renter and would like an attorney appointed to represent you, you can contact the Eviction Defense Screening Line at 855-657-8387 or apply online at the address on your screen. We've got additional information at 2 other information sources that are on the screen, and there are free or low-cost mediation services also available at this site. We have this up, Josie, now? Okay, thank you. I want to touch briefly on transportation in our state. This is an issue that remained unresolved when the legislature concluded their work in April. Since then, I've been meeting with legislative leadership, House and Senate Republicans and Democrats, and my staff has met regularly with the Four Corners to discuss the need for a transportation package that meets the needs of Washingtonians. These include a long-term plan for funding the repair of culverts that block fish passage. It includes multimodal transportation, ferry replacement and electrification, and vehicle electrification, as well as an I-5 bridge over the Columbia River, and a multitude of other needs in the state. It's my understanding that House and Senate transportation chairs are meeting to determine if there is a possibility of getting a transportation package to my desk. And I heartily encourage that that be done. I would support a special session if an agreement can be made to make that productive. I'm offering my assistance to my staff and the Washington State Department of Transportation staff to legislators in this work. I want to note on a separate subject that on October 1st is an important date for Washington families looking for affordable child care supports. Through the Fair Start for Kids Act, which I signed earlier this year, more families are now eligible for the Working Connections Child Care Program. That's administered under the Department of Children, Youth, and Families. This will mean lower co-payments for many families who lack access to affordable child care. And you can check eligibility and apply online at washingtonconnection.org, or you can call 1-844-626-8687. A few comments about COVID. Obviously, we still remain very deeply concerned about the pandemic. The numbers of cases, of hospitalizations, and deaths are grossly unacceptable in the state of Washington. Providence St. Peter's here in Thurston County recently had 10 people die in 24 hours, a record throughout the course of this pandemic, which has already been such a hardship to so many. We recently passed the 7,000 mark of Washingtonians who had died during the pandemic. Now, every one of these heartbreaking cases is something that tugs at us, particularly now, because almost all of them are preventable deaths. We now have a vaccine that can prevent these deaths. The 10 people who lost their lives in 24 hours did not have to die. A vaccine was available to them. And we are now involved in an effort to see that it saves more lives in the state of Washington. I know that every day we hear stories about families who have been touched by this tragedy. And every day we hear of the frustration of people who lost loved ones because they did not get the vaccine. This morning I read about two daughters, one who was a respiratory therapist, trying to talk their mother into getting the vaccine. But unfortunately, she had listened to social media, misinformation, and conservative media that had filled her with deception and untruths about this vaccine. They were unable to convince her. Even a respiratory therapist was unable to convince her mother to get the vaccine. The ending of that story is just as sad as you can imagine, because she then contracted COVID, got sick, and 12 days later passed away. These two daughters lost their mother, who left us at age 57, in a preventable death. Now, the reason I mention this is that I want to thank some people who are trying to prevent these deaths. I want to thank the family members who are talking to their family members to try to save their lives. Sometimes those conversations involve some degree of tension, but if they can save a life, it's worth it. And those family members are just as important in this effort as any state or county agency. So if you are helping someone you love to understand the true facts about this vaccine, not the deception you hear on social media, to try to save their lives, thank you. You're a hero in this effort against this pandemic. Now, of course, I also want to thank the healthcare workers who have just been working unbelievably hard for so long. And now they deserve more people to get the vaccine, so they are not put through the stress day after day of holding the hand of a dying person who wished they would have got the vaccine. Our healthcare workers deserve people to get the vaccine. I sent a letter earlier this week to the administration asking for assistance to get more help in our healthcare system. It is extremely strained. People are not getting healthcare because of COVID. We've read multiple stories of people who can't get needed surgery because it has to be deferred because the hospitals are jammed with COVID. I read about a fellow who couldn't get a bone marrow transplant, fellows who can't get heart surgery. Everyone's suffering this because of this COVID pandemic. And everyone has a chance to help our healthcare workers by getting a vaccine, as well as themselves. I hope that that will happen. I want to mention the Canadian border situation. We continue to be extremely disappointed that the administration has not opened the border to vaccinated Canadian citizens. This is an incredible hardship on not only the Canadian citizens, but Americans and Washingtonians who are suffering economically grievously because of this unnecessary, unreasonable restriction. A vaccinated Canadian is no more dangerous than a vaccinated a person from anywhere else in the state of Washington or any other state in the United States. So we will continue to press the administration. I'm writing a letter to the president urging him to reconsider this policy. I spoke yesterday with leaders of the Point Roberts community. That is Exhibit A, why this current policy just does not make sense. Now, to help Washington businesses who were impacted by this decision, I've announced a new round of emergency grant relief funding for businesses that have been impacted by this border closure. This program will deliver grants of up to $50,000 to businesses impacted by the U.S.-Canadian border closure, and is in addition to the $100,000 of strategic reserve fund dollars we've already deployed. Now, the application portal for these new grants will open October 4th to October 18th. This targeted grant program will prioritize customer-facing businesses that will require direct person-to-person interaction for businesses located within 20 miles radius of the Canadian border. We have today Lacey Fehrenbach and Nick Struley here to help answer any questions you have. And with that, I look forward to your questions.
Governor, on the rental systems, how the system is currently structured is part of the reason that there's a backlog. Why not streamline the process and have Commerce be responsible for getting that money directly to where it needs to go?
Well, this is established largely by the federal government. And the good news is just in the last couple of weeks, they have streamlined this process. We believe it will significantly allow us to accelerate the rate of payment. Certainly King County is in the process of doing that. They now allow personal verification of income status and the like and rental status. That'll hasten the application process. So we believe that streamlining has already taken place and will dramatically accelerate the distribution of funds. And that's very, very important. And in our discussions with local leaders, they do believe by the end of October, we'll be in good shape.
How certain are you, though, that you won't have to do another extension at the end of October?
I am as certain enough to say that we should have this done by the end of October. That is our present intention. And I'm quite confident that we'll be able to achieve that.
Question for the governor and a question for Lacey. For the governor, are you considering extending the timeline for state workers to get vaccinated, especially since you're still bargaining with half a dozen of the smaller state unions? And then for Lacey, do you have any sense about what the next 3 to 4 weeks in the Washington hospital system will look like in terms of caseload? What you have any idea about that?
Lacey, do you want to answer that?
Sure. Good afternoon. Thank you, everyone. Lacey Fehrenbach, Deputy Secretary, COVID-19 Response. So we are, due to policy actions that were taken last month, seeing some slowdown in growth, both for cases and hospitalizations, but our hospital system is as stressed as it has ever been. We hope that continued efforts around masking and vaccination will lower our disease levels and reduce the number of people being admitted on a regular basis to the hospitals, which will then, make some space and reduce the occupancy. But I think we're in still for a tough few weeks ahead.
Can we just show the rate of fatalities? I'll put up on the screen the graph showing rate of fatalities during the pandemic. You'll see we had such a steep curve. We're still at a very, very high level of fatalities on a daily basis. And I want to just tell you, every single one of those is a tragedy, not just a number. We also have to be adept in understanding that we have to drive this pandemic into the ground. Even if this number comes down in the upcoming months, if we don't get more people vaccinated, it could come right back up again, given all of the changes that are happening. More children going back to school, more people going to large events, more people going inside because it is winter. We have to get more people vaccinated if we're going to have confidence of getting on top of this pandemic and return to normalcy. No, we are not considering extending the deadline for vaccination of state employees. This vaccine is readily available, and people have had a chance and still have a chance to get it, and we heartily encourage it. The impact bargaining we have is not, the completion of those things are not necessary to the application of the general policy. And I'm pleased to say we have reached a conclusion with quite a number of our bargaining units. We're very happy about that.
Governor, given the hospital staffing shortages that are already existing, what are you hearing from healthcare facilities about the possible effects of the vaccine mandate on their staffing and services, especially in Eastern Washington where vaccine rates are lower than on the south?
I'm hearing that healthcare workers and hospital administrators want people vaccinated because one of the huge problems we've had for months now in our staffing is because their staff get COVID. And when they get COVID, they can't work. And when they're exposed to COVID, they have to be quarantined. So we are trying to reduce the staff shortages that are caused by COVID. And the best way to do that is get people vaccinated. So this is a strategy designed to reduce the staffing shortage long-term by getting people vaccinated, because it is the COVID virus that is hollowing out these hospitals. And every hospital administrator will tell you that. Same thing with long-term care facilities. So this is a system that we believe is the best strategy to increase staffing available in our medical community.
But are you anticipating losing a lot of staff because of that?
No, no, we believe that at the end of the day, the vast, vast majority of people who have gone into public service, people who've gone into healthcare, people who've gone into education will have a discussion with their family and conclude that if you really look at the medical science, this is a healthy thing to do and not lose a career. And we want these people to stay. Look, these people are very valuable to us. The state employees that we have, hardworking people, do great work, very important work, and we want them to keep working with us. We also want them to not lose their lives. And so we can have both of those things, and I'm confident Washington State will continue to provide high level of services to citizens, and we are going to get more people to save lives in our state.
The request, though, you made for the 1,200 federal assistance for the hospitals, did that take into account a concern about potentially losing some of the workforce because of the vaccine mandate?
No, because we already had a concern about staffing levels already because of the fact that we had so many people get COVID in the healthcare system and couldn't work. That pre-existed anything we did about a vaccine mandate. That has been a long-term concern of ours. Now, we don't know, we have not had a response from the federal government. We have to understand the whole country is in need of healthcare workers too. The whole country is short of healthcare workers. There's only one state that has a mandate, or at least of the type I've proposed. So it's not my mandate that's causing this problem. It's COVID, and it's unvaccinated people. That's the fundamental problem.
But Governor, there are 600 state and local workers who signed on to the lawsuit against your mandate. They're standing firm, they're ready to lose their jobs, and their plea to you is to follow the lead of California, New York, and New Jersey and allow for testing and other accommodations. What's your reaction to that?
We have found that testing does not save people's lives. It just is not adequate to the task. And as I've discussed with you before, I went to a funeral service for a state employee, Department of Correction officer, who tested negative 30 times and then died of COVID. So it is not adequate to the task. And I believe at the end of the day, people will decide to remain in public service by and large, that the vast majority of Washington employees will continue to work. We have over 60,000 people. And the vast, vast, vast majority of those people, I believe, will both be in public service and be vaccinated, and that will be a success. For those who do decide to leave public service, we have plans to be able to deal with that. This is not a untoward situation. We have about 10% replacement every year in the state of Washington. We know how to do this. We don't want to have to do that. We want people to stay. But we have contingency plans in place for those who do want to leave public service.
Governor, would you speak to landlords who say they're working with tenants in good faith? Very few of those tenants are taking advantage of these moratoriums, and they're unhappy that it's being extended even for another month.
Well, I'm not sure I understand your question, because if they are successful working for their tenant and the tenant's paying the rent, this moratorium is not a problem for them. So I'm not sure I understand your question. For those who are paying rent, this moratorium it doesn't mean anything to them, doesn't stop them. They're going to continue to pay rent.
But they're concerned that those who would take advantage of the moratorium can still do that. They have a few tenants doing that. And they think that after all this time, the moratorium is no longer necessary.
Well, I can understand their feelings about that. It has been quite a period of time. We did not think it made sense to end the moratorium while we had millions of dollars sitting in our pockets, not distributed to these tenants. Our basic idea was to create a bridge situation where we could get to a more long-term sustainable situation. So that's what we're doing. It's a relatively short continuation. It will allow the rental program to work. I believe it will work, and we will have a relatively sustainable position. For those, now, I'm sure there were those who criticized us too for not doing this, a long enough extension. But we have to understand that at some point this moratorium had to come to an end, and this is a reasonable time given the fact unemployment is down. We've had a period of time, and we now have a rental assistance program also available. So we think it's a reasonable position. It's been hard on everyone, and we're looking forward to a more stable situation.
Governor King 5, we've reported for the past 4 months on the foster care system, which has been housing kids in DCYF office buildings, and in some cases even in cars as punishment, we're told, for misbehavior by those kids. And the state oversight board, or DCYF oversight board chairman, has told us that he doesn't think that Ross Hunter, Secretary Hunter's been that cooperative with the board and answered its questions. And the DCYF ombuds has told us that he doesn't think the solution that DCYF has put forward to end those hotel stays is going to work. Do you have confidence in Secretary Hunter's, the way he's doing his job, and is DCYF doing the mission that it was intended to do?
Yes, I have confidence we're moving in the right direction. We have more work to do. There have been some recent proposals on how to have a better situation. We obviously want to have the best situation possible, and we'll continue to seek insight and suggestions on how we can improve it, and we will continue to do that.
Anybody on the phone? Peter? Going online, we have Nicole Jennings with Power Radio.
Good afternoon, Governor. Hospitals around the state are desperate for monoclonal antibody treatment. I spoke to one in Yakima today that says they have enough for 41 people when hundreds of locals in the area are testing positive for COVID. What is the plan to get more of this life-saving treatment and to distribute it to more facilities around the state?
Well, this is now a national distribution decision. The federal government allocates it to states dependent on usage and population. So we're making orders, but there's only so much to go around, and the federal government controls the distribution at this point. So I know that there are people that would want this treatment. We think it can be very beneficial. Now, we wish more people wouldn't have to get that treatment. And it always is a little frustrating to me, to people who will accept the monoclonal antibody but didn't get the vaccine that could have prevented them from getting sick in the first place. We need people to get the vaccine. There's not enough monoclonal antibodies available in the United States to treat everyone who could use it, frankly, for COVID. That's just a physical reality. But we got plenty of vaccine to keep you from getting sick before you have to go to the hospital. We really hope people do that.
Final question online comes from Phil with the Yakima Herald Republic.
Phil, are you there from Yakima? Are you muted?
Yep. Can you hear me?
Yeah, go ahead. Go ahead, Phil. We heard you for a minute. Then we lost you.
Can you hear me?
I can now, yes.
Phil, you keep muting yourself.
I try.
Are there any other questions in the room while we try to get Phil taken care of? Any other follow-ups from anybody in the room?
You commented your lawsuit against you will not be successful.
Yes, we feel that we're in very good grounds. We have a statewide emergency. We have a raging pandemic. We are taking reasonable steps to save public lives. We think we're on good grounds in this regard. We know people have the right to go to the judicial system and have executive actions reviewed. But that's been done over 30 times already during this pandemic, and so far, not a single action of ours has been vitiated by the judicial system. So we do believe we're on good grounds. We intend to save lives. That's the right thing to do.
Now we're gonna go back to Phil.
Phil, we might have to wait till next.
I think I'm set up now. If you can hear me.
Go ahead.
Maybe Phil can email us his question. We'll have him do that, Governor.
Yeah, Phil, if you can
Can you
email.
hear me?
Yes, briefly. Try again.
Okay, we'll have Phil
Okay.
email us.
Phil, why don't you email the question and we'll try to help you out there. Sorry, Phil. We'll be back to you.
Any final words, Governor?
No, I want to thank people for their continued work during this pandemic. Thank to everyone who's helping save lives, because everybody can save lives in the state of Washington. Let's not let misinformation kill a single more life in the state of Washington. Let's not let another mother or son or daughter fall victim of COVID because they listen to social media. Let's speak up. Let's wrap our arms around each other and save each other. If we do this, it's going to be a brighter day in Washington. Thanks very much.